we're talking mostly about the nervous system. So when it comes to chiropractic, a lot of what we do is completely based on our nervous system. So when you think nervous system, think like your brain, your spinal cord, and all the nerves that go out and talk to every cell, every tissue, every organ, every muscle, every ligament, every gland. Your brain is constantly sending signals out to function your body. So we're going to use the word function pretty strongly here in this kind of nervous system talk. So I've got a little picture of the spine here. Now imagine every single vertebrae has its own specific nerve that goes out to every single area of the body. So when there's any dysfunction in the body, there's going to be a decrease in that communication to whatever ligament or cell or organ it's going to. So think your low back nerves are going to go to your gut, your uterus, your stomach, all of those areas. So if you have a decreased gut motility, decreased digestion, different things like that, that's going to cause, that could be coming from a dysfunction in your spine or nervous system in that area. So there's two parts of the nervous system. We have our sympathetic and our parasympathetic. So when you think of a sympathetic nervous system, you may have heard this before, but it's your fight or flight response. So that's when we're stressed, we're in danger, or physically active. So you may have heard me, Mark, or Carly say, your body doesn't know the difference between your HIIT workout or a bear chasing you. So that's where your sympathetic nervous system is coming into play. It doesn't really know the difference between the two. So we definitely want a balance between the two. The second one would be parasympathetic. This is our rest and digest. So this is where we're relaxed. This is where we're healing, we're restoring, we're in that restful state. And this is where chiropractic is huge. It's going to come in, it's going to promote the parasympathetic system to come in and do what it's supposed to do. So I don't know about anybody else, but 2025 is a little stressful these days. Everything going on in the world is kind of crazy. So I think we could all use a little bit more time in that parasympathetic state. And we always want to be urging our bodies to do that because that's where we really heal and let our bodies function. So this is going to sound a little wordy, but bear with me. I will kind of break it all down. But the body does not perform as a cluster of separate mechanisms, but it's a cascade of events that start all by the nervous system. So that brain to spinal cord through the nerves, controlling every single function. So if I need to wiggle my hand, my brain's going to send that communication to my hand and every single muscle and cell in this area to get that to function. And that's what every single body function is doing throughout the day, through every single thing we need to do. So when we have the interference, so when I say interference, that could be the area of your body that needs a chiropractic adjustment. So whether it's your low back or your knee or your neck, we use the word like subluxation, and that's just going to indicate where you're needing the adjustment. So that is a decrease in function or dysfunction, and we need to bring function back to that space. So biggest thing here is pain is not what we want to see. So pain is going to be the clue that something is fully dysfunctional at this point. So if people say like, I've had IBS my whole life. So that's going to be a dysfunction of that area for a really long time because that's a symptom. That's not necessarily just something that happens. So this is happening all over the body. And we like to say, by the time you get a symptom, you've already lost 90% of function to that area before that light switch kind of turned off. So we're going to get into that in a little bit here too. But the biggest thing here is chiropractic adjustments aren't just going to treat your pain. We're removing that dysfunction from the structure so that the brain can communicate to the body in its best capacity. So that is not just, I just adjust your neck because you have a headache. I adjust your neck so that your brain can communicate to your arms, to your heart, to wherever those nerves are going. But we don't always see symptoms as bad. So they're just the message the body sends to us to let us know that there's something that it can't fix on its own. So that's just the message that clues you into, hey, something is not going right. We can't fix it on our own. So let's find some help. So that's when you come see us. So just a big one. Another one is just because the absence of pain does not mean you are healthy. So a lot of people could be 35 years old and say, I feel amazing. But they just might be losing dysfunction, haven't quite hit that spot where the light switch is out. So that's a big reason why we use the applied kinesiology, because that's going to kind of clue us into exactly where the light switch is out, where the dysfunction is happening, and how we get it turned back on. So kind of like I mentioned already, chiropractic is not just about the spine. It's about how well your brain communicates to every single cell, every tissue, every organ, every muscle. So that includes your drainage pathways. So think your lymph, your kidneys, your liver, your bowels, of course. And then you have gut and the microbiome. So you've probably heard your immune system lives in your gut. So that's where that microbiome comes into play. And just the ability to detox. So if you've been in our office, you know how much we encourage the natural detox of your body, and the fact that we are so bombarded with toxins all day long, we can't always detox all of that on our own. So that's where the adjustment's going to help get the brain to communicate to all those drainage pathways and get them open so they can work on their own. Another huge thing that people don't realize is that chiropractic can strengthen your immune system, usually by about 200% or up to 200% for every adjustment. So think if your spine is full of that subluxation or the need for an adjustment, imagine your body is spending so much energy trying to correct the spine on its own. And a lot of times it can't. So that's that much energy it can't spend on healing your illness or your sickness, or draining out all the bad bugs that are in your body. So we always say, as long as you're not running a fever, come get adjusted if you're not feeling your best. Right, kind of a little bit more over this. And I'm going to send out this presentation so everybody can have it at home. There's a lot of extra goodies in here that I'm not going to mention. There's like a bunch of extra slides that we're not going to go over today, but you can kind of read over at your leisure. Moving right along. Kind of briefly mentioned this earlier. So our bodies want to do that self-correction. So our bodies try our best to fix all of those, if you want to call it a subluxation, or fix the dysfunction. And when it realizes that it cannot, that's when we start to get the symptom, or our dimmer switches start to go out. And then once the light switch is out, we get that symptom, and we've lost the dysfunction at that point. So what stressors cause subluxations? Physical, obviously that's a big one. That's going to be the sports we used to play in high school. That's the work we do, the sitting at the computer that we're doing for 8 hours on end. A big one is chemical. So that's where the drainage pathways come in. So the products we're putting on our body, the plastic our food is stored in, especially if we're not eating whole foods, we're going to get just a bombard of chemical toxins that are going to stress our body out and cause that subluxation or dysfunction in the body. So emotional is another huge one that we like to talk about. Negative emotions can also turn those light switches out, cause that dysfunction. So making sure our emotional health is just as prioritized as our physical, and then as well as the chemicals that we're putting in our body. So as far as applied kinesiology goes, I know I'm going to sound like a broken record here, but the nervous system is that direct communication from your brain to every cell, every tissue, every organ, every muscle, every gland throughout the whole body. So those stressors are what's going to cause the dysfunction, interrupting that direct communication, and that's where that light switch is going to get flipped off. So once we have those light switches off, we have those interruptions, that's where we kind of use the muscle testing to find those, adjust those, and get them turned back on. Restoring the function. Okay, so by definition, applied kinesiology is a system that evaluates structural, chemical, and mental aspects of health using the manual muscle testing combined with other methods of diagnosis. So that's going to be like your history, maybe a blood test here or there, but it's a non-invasive system of evaluating the body's function. It's pretty unique in the healing arts, and it's become a dynamic movement in healthcare, and it's pretty short existence. So if you've ever been muscle tested by one of the docs or haven't, it's pretty cool. It's very intuitive to your body, and it tells us exactly where we need to go with that adjustment so that we're not overpowering the body. So like I said, it tells us exactly which vertebral level, which joint specifically that needs that adjustment. So we don't have to guess, or we don't have to just adjust anything that's going to make a pop or crack. We can ask your body exactly where we need to go. So we're not overwhelming that nervous system. So think if I just go in and adjust, pop, crack, everything that might make a sound in your body, I'm going to flip on that sympathetic system. Whereas if I only go in and do exactly what your body needs, I'm going to turn on that parasympathetic system. And that's where our body can do all of the work it needs to do. So big thing here is that we're not doing the healing. We're just aiding in the process, allowing your body to do the healing on its own, the functioning on its own. So think like inflammation. Inflammation is the thing that our body does naturally to get our tissues healed, to get whatever our internal nervous system recognizes as a dysfunction. It wants to do it on its own, and a lot of times it can't. So think too many toxins, too much sitting at the computer. Whether you're a gamer or a TikToker or whatever it may be, the places we spend a ton of time in those positions, it's what's going to cause the subluxation or the dysfunction. So that's all I've got for you. Thank you guys for joining. Next month, Dr. Carly is going to be talking all about gut health, so make sure you join in. And if you have any questions on what we talked about, I'd love if you would drop them in the chat, and we can absolutely discuss them. Let's see, we've got one. Oh, it's just Bliss.
Lydia, can you talk a little bit about why it's important for babies to get adjusted?
Absolutely. So when I think of babies getting adjusted, I think they just went through a pretty serious, I don't like to call it trauma, but a pretty serious life event where they're increasing a lot of tension in their fascia. So when I say fascia, I mean I've actually got a slide on this. Babies. Here we go. Okay, so yeah, the birth process is going to be a lot of work on their little bodies. They've been kind of tucked into that small space for a long time, and they can create like areas of tension in their body, especially like in their neck, in their belly, in their feet. And we just want to make sure we can like relax all of that. So we talk about unwinding their fascia. So especially if babies like start to pick a side of the neck that they like a lot, it's a sign of tension. Or if they're spitting up, or if their latch is super uncomfortable, we can adjust all of that through like releasing their tension. So Bliss asks, how long until someone can expect to see results from consistent treatment? So we have people that see results from day one. It's not always the case. You can definitely notice a huge difference from just one adjustment. It does take a couple to usually get the light switches to stay on. So that's the main goal, is making sure the function is staying there. It's not once we go back to our desk, once we go back to the things that in our lifestyle that cause the dysfunction, those flip our light switches back out. So we definitely do want to continue care, and that's why we really encourage like our maintenance care. Once you go a couple weeks back to our desks, back to whatever labor we're doing, we want to make sure we can maintain all of the work we've done in the space where we're turning all those light switches on.